your nurse today. We're going to be doing a cardiac assessment, okay?
Okay.
But first I need to review your vital signs, okay?
Okay.
Okay, it looks like your vital signs are normal. How are you feeling today?
We're fine.
Okay, any chest pain or shortness of breath here lately?
No.
Okay. Can you tell me your name and your date of birth?
Lisa Lynn Stearman. My date of birth is September 24th, 1969.
Okay, where are we?
We're at my house.
Okay, and what day is today?
February 18th, 2018.
Okay. Now I'm just observing my patient's chest and making sure she's breathing normally. Her skin looks good. She's got a nice color for her ethnicity. And now I'm just going to feel along her skin here. She's nice and warm. She's not cool or clammy. Now I'm going to look at her hands. I don't see any evidence of clubbing on either hand, which could indicate that she has been without oxygen. A late indicator that she's been without oxygen for a while. Poor circulation. Looks like now I'm checking her capillary refill. She's got good circulation here. See how I'm pressing on your fingers and the color comes back quickly?
Mm-hmm.
That means you're getting good circulation. Okay. Now I'm going to look into your eyes and make sure you have a good pink color. Looks good. I don't see any blue color or any indications that she has been without oxygen. Looks like she is perfused nicely. Now I'm going to look at her neck. Just kind of feel here. Can you turn your head this way? I don't feel any hardening. The jugular veins or arteries. That could indicate atherosclerosis. I don't feel any swishing. Okay. Now, using the bell side of my stethoscope, I'm going to auscultate and check for any loud pitching noises or bruise. Turn this way. Okay, I'm going to come to the other side. You can just turn your head this way. Now using a flashlight or a pen light, I'll check for any jugular vein distension, which could indicate right-sided heart failure. Okay, looks good on that side and this side. Okay, everything looks good. Now for this part of my assessment, if we were in a real life scenario, I would have my patient shirtless, but for the sake of the video and the privacy of my patient, we will just keep her shirt on. But I would observe her chest movement, make sure her chest is symmetrical, and then I would look for the PMI or point of maximal impulse, just down here, approximately the 5th intercostal space mid-clavicular line. Through her shirt, it doesn't appear that you can actually visualize it. So I'm going to find it here. My hand here, I can feel it. But it's not so hard that I feel any thrills or lifts. I'm not feeling like my fingers are being pushed off of her chest, or I don't feel any rolling. Okay. Now I'm going to move on and use the diaphragm of my stethoscope to auscultate the 5 precordial areas. The first is the apical pulse, which will be the 2nd intercostal space, right sternal border. Then I'm going to auscultate the pulmonic area, which is 2nd intercostal space, left sternal border. And then the second pulmonic area, which is the third intercostal space, right sternal border. And then the tricuspid area, to auscultate the tricuspid valve, fourth intercostal space, left sternal border. And then finally, again, my PMI, or point of maximal impulse, is also to auscultate the mitral valve, which is fifth intercostal space, mid-clavicular line. And I'm checking for the lub-dub sound. Can you lean forward for me for just a minute? Very good. Everything sounds good. Now I'm going to turn my stethoscope to the bell side, auscultate the same points again, and listen for any bruits. Your heart sounds are very good. I'm going to document my findings, and then I will report them to your physician. Thank you for letting me do your cardiac assessment with me.